Go ahead, ma'am.
Good afternoon, everyone. I'm Dr. Parinaaz Parhar, and today I'll be talking about the preconceptional counseling, which is going to serve as the first step towards a healthy pregnancy. I'm the clinical head and consultant at Oasis Fertility Secunderabad, and today I'll try to make this session as useful to all the patients who are looking forward to start a family soon. So, why is preconceptional counseling important? The whole goal of preconceptional counseling is to try and have a planned pregnancy where we can reduce the risks of any adverse health effects for the woman, for her unborn child, and for the family as such. The whole aim is to try and optimize the lady's health before she goes ahead and starts a family. We want to address any pre existing risk factors that the patient might be having and provide her all the support that she needs in order to have a healthy pregnancy. So, in short, the whole aim of preconception counseling is to try and understand what are the risks that you have to try and get you as fit and healthy for your pregnancy so that you can have a safe and smooth pregnancy and at the end of it have a healthy bundle of joy. So, to start with, when we are talking about pre-pregnancy, preconception counseling, a lot of times the first question that a patient would ask us is that when is the right time to plan a pregnancy? This question is usually comes across from those patients who already have one child. They would be like, doctor, is it safe for me to plan a child now? Is it too early? Is it too late? What should be the right time to plan a pregnancy after you've already had a child? So, for those who already have a child, you should be planning your second pregnancy no sooner than 6 months after your first. Ideally, your second pregnancy, there should be an interval of about 1.5 years between the two pregnancies. That gives the mother enough time for her body to try and recover from the first pregnancy. And obviously, the timing, the spacing between the two kids is enough so that you can give them adequate attention. So, ideally, the gap between two pregnancies, the interval should be around more than 1.5 years, but definitely not less than 6 months. As for the question of when is the right age to try and plan a pregnancy, the right age is whenever you feel you are emotionally, mentally ready, financially ready to start a pregnancy. But yes, ideally, you should plan it in your early 30s, late 20s. That would be the best time. The earlier, the better. So if you feel you are at the stage in life where you can afford a pregnancy and start a family, the earlier it is, the better it is. If you're someone who has been trying for a pregnancy for more than 1 year and you are less than 35 years old and you have been unsuccessful in spite of having regular unprotected intercourse, well, in that case, you need to get evaluated to find out what is wrong, if anything needs to be done to try and improve your chances of conception. If you are someone who is more than 35 years old and has been trying regularly to conceive since the past 6 months, then again you need to consult a specialist to try and get yourself evaluated to find out if anything is amiss and what is really stopping you from conceiving. Now, this is about when you should be really planning. When is it that whenever you feel that you're ready to start a family, that would be the right time to go and have a preconceptional counseling session with a doctor. The doctor can be a gynecologist, a fertility specialist, or even your general physician. And the whole objective of this counseling session will to help, like I mentioned before, to try and understand whether you are physically fit to plan a pregnancy, whether you're at the right stage, whether there are any pre-existing risk factors which need to be managed before you start a pregnancy. So I will be talking about all these things. Now, when we talk about patients who are planning a pregnancy, one of the first things that we tell the patient is please start a folic acid supplement. Now, folic acid is basically a vitamin, and it's a B complex vitamin, and it's just a small tablet which needs to be given in a minimal dose of about 400 microgram per day. Now, why is it so important? It is important because its deficiency has been associated with certain neural tube defects. What is a neural tube defect? Neural tube defect means that if you have any central nervous system, if you have any lesion, any problem, which is abnormality, which is involving the baby's spine. So a deficiency of folic acid is associated with problems of the baby's spine. So since this is a genetic defect which is associated with a deficiency, a nutritional deficiency, it's quite easy to correct. So it's one of those things which can easily be avoided. That's why if you are planning a pregnancy, it is advisable that you minimize the risk of having a neural tube defect in the baby by taking folic acid supplement. Now, for how long do you take and how much do you take it? You should be taking folic acid supplement in a dose of about 400 micrograms daily for about 3 months before you are planning a pregnancy, and it should be continued into the first 3 months of pregnancy. Now, most of the uh, patients, the dosage of about 400 microgram would suffice. But for those patients where the mother is suffering from diabetes mellitus, or if you are a carrier, or if you're having thalassemia or sickle cell anemia, or suppose the mother is having a BMI of more than 35, she's having any malabsorption disorder, these are a couple of conditions where the patient would need a higher dose of folic acid. Even if you're a case where you are on certain medicines which might metabolize folic acid faster, or you are on anti-epileptics, then again you're required, or if you are having a family history or you yourself have had a baby with a neural tube defect in the past, in those cases, your daily requirement of folic acid is going to be more than that which is required for the general population. You might need something as high as 4 milligram of folic acid daily. Now, routinely in India, basically, we are giving this dosage to patients. So when you go ahead to buy a folic acid tablet, just a folic acid tablet, it would be having about 4 milligrams. So that is the dosage which is required for patients who are having a increased risk of having a baby with neural tube defect. So those are the ones who have a previous history of having a baby with neural tube defect, those who are diabetic, or those who are epileptic patients who are on anti-epileptic medications. So that's about folic acid, and it is important. It's one of the simplest things that you can do in order to reduce the risk of something as serious as a neural tube defect in your baby. So the first thing first, start folic acid if you're planning a pregnancy. The next thing is that now you have decided you want to start a family. The next thing which you can look at is, what is the ideal body weight? Is your body weight falling into the ideal range? Why is this important? Because if your body weight, okay, so first start with what is the ideal body weight. So we'll start with talking about something called as a body mass index. Your body mass index is calculated by dividing the weight in kilograms divided by the height in meters square. So your body mass index for Indian population ideally should be between 18 kilogram per meter square to about 22.9 kilogram per meter square. That is the normal range. The upper end is lower than what is seen for the Western population. So for the Indian population, the ideal body mass index is 18 to 22.9. If your body mass index is less than 18, you are considered to be underweight. If it is more than 23 to about 24.9 kilogram per meter square, you are considered to be overweight. Anyone having a body mass index of more than 25 kilogram per meter square is considered to be obese. Now, I'm talking specifically about the Asian Indian population. We're not talking about the international standards because they are the parameters are different. So for the Indian population, if you're planning a pregnancy, ideally the weight range should be between a BMI of about 18 to 22.9. Now, if your BMI is high, if you're obese, by which I mean that suppose your BMI is more than 25 kilogram per meter square, in that case, there is an increased risk of infertility, there is an increased risk of miscarriage, higher risk of having birth defects in baby. If you conceive, there's a higher risk of preterm delivery, gestational diabetes, developing hypertension in pregnancy. You might have dysfunctional labor because of which your tendency of needing cesarean section for delivery increases. And even during and post-delivery, there's a high risk of developing some clotting disorders which can be life-threatening. Obesity by itself is also associated with increased risk of conditions like stroke, heart disease, cancer, arthritis, high cholesterol, hypertension, and diabetes. Now, if you know that a condition which is modifiable is putting you and your baby to a risk of so many things, and if you're going for a planned pregnancy, it makes sense that you try and lose weight and come down to the normal range to try and make your pregnancy as soon as possible. So that is one of the benefits of understanding, going for a preconception counseling and getting motivated to try and achieve a body weight which reduces your risk of adverse effects in pregnancy. Now, the other thing is that why is it important to control? It's the thing is that you cannot, it is not advisable to lose weight during pregnancy. So you can't say, okay, fine, I'll just, I'll get pregnant now. That's more important. Once I'm pregnant, then, I have 9 months to try and lose this weight, or I won't gain that much of weight. That's not important. That's not advisable, because you're supposed to have a certain amount of calorie intake in pregnancy. A calorie deficit, which is required for weight loss, is not recommended in pregnancy. So if you are overweight or if you're obese, please, for you and for your baby, try and reduce your weight before you're planning a pregnancy. Now, this was about the ladies who are overweight. What about the ladies who are underweight? Even underweight ladies are known to have a higher risk of having babies who are small for gestational age and having low birth weight infants. In fact, they're even at an increased risk of having preterm labor. So again, underweight is also not advisable. If you're someone who's having a weight, a BMI of less than 18 kilogram per meter square, please have a nutritional consultation, have a dietitian's consultation to try and help understand why you're on the lower side of normal, and to try and modify your diet so that you can reach in the normal body mass index range. Now, suppose if you're overweight, one of the options which are available is for you to go for a bariatric surgery. If you're obese, and as per the Indian standards, if your body mass index is more than 37.5 kilogram per meter square. For internationally, globally, the limit is 40. But for the Indian population, if your BMI is more than 37.5 kilogram per meter square, you can be considered for bariatric surgery. If you're someone who has a BMI of more than 35 and you have associated hypertension, diabetes, again, you can be considered for bariatric surgery. But it is very important to understand that if you're going for a bariatric surgery, you should be waiting for at least 1 to 1.5 years before you plan your pregnancy. And why is it so? Because bariatric surgery is a huge change for the body. A lot of patients, because of the kind of surgery, they would be suffering from malabsorption syndrome. And there would be some nutrient deficiency which would be produced. So to try and help the body readjust to all these changes, it is important that you have a gap of at least 1 to 1.5 years before you plan your pregnancy if you're someone who has undergone a bariatric surgery for various reasons. Now, what kind of exercise is important in order to try and achieve your ideal body weight and to have the required physical strength for a pregnancy? Now, it is highly recommended that you indulge in some sort of regular physical exercise to improve your cardiovascular health, reduce your risk of obesity, and in general for your general well-being. Now, how much of exercise should you be indulging in? About 30 minutes a day, 5 times a week. So, and in total about 150 minutes of moderate exercise per week. Now, this intensity of exercise you can continue well into your pregnancy and into your postpartum as well. All that you need to remember is that keep yourself well hydrated. I would strongly, I would actually encourage you all that if you are physically active before pregnancy, please try and have a very healthy, indulge in exercise during your pregnancy, consult a gynecologist, and please be active in your pregnancy as well. That will help you in your labor. That will help you in tolerate the physiological changes of pregnancy as well. So yes, start being physically active and indulge in some sort of exercise as you're planning for your pregnancy, and continue with this routine well into your pregnancy and later on in order to have a better outcome. Now, the other important aim of preconception counseling is to try and understand whether you have any medical, surgical, or psychiatric history of significance. Certain chronic medical conditions like diabetes, hypertension, psychiatric illness, and thyroid, all of them will lead to major changes in pregnancy, which might need dose adjustment. There might be an increased requirement of the medication. There might be an increased risk of the disease worsening in pregnancy, which might adversely affect you and your baby. So before you go on to become pregnant, if you're planning a pregnancy and if you're suffering from any of these chronic medical conditions, any pre-existing medical condition, it is important that you speak to your primary doctor who's treating you for that condition and your gynecologist and understand what is the effect of your particular disease on your pregnancy, to understand whether the medicines which you're taking to control it are safe for your baby and how it would impact your baby and your pregnancy. So, some of the common medical conditions and their impact on pregnancy is what I'm going to discuss. If you're someone who has asthma, diabetes, hypertension, hypothyroid, epilepsy, or some clotting disorders, these are some of the conditions which you should actually be seeking medical advice for before planning a pregnancy. And the reason being, because if you're someone who has asthma, it is preferable that you are on inhalers rather than oral medications for controlling your disorder, because that is safer for your uh, baby. As far as diabetes is concerned, a lot of our patients, we're seeing India is supposed to be the diabetes capital of the world. So we are seeing a lot of patients who present to us with diabetes. What they don't tend to understand is that it is very crucial for the baby that your diabetes is well under control before you plan a pregnancy. For you, the doctor, the endocrinologist might say that, okay, your HbA1c or a glycosylated hemoglobin level of more than 7.5 is good enough. But when you're planning a pregnancy, we need it to be at a target of less than 6.5. The reason being that the early part of the pregnancy is the period of organogenesis. And it's very crucial that you maintain a sugar level of less than 6.5 HbA1c during that period, because anything higher than that is associated with birth defects in the baby. There will be faulty organogenesis during that period, and babies whose mothers had uncontrolled sugars at that time have been found to have higher risk of spine defects, heart defects, and other life-threatening conditions. So, diabetes, it's very important that your sugars are well under control before you're planning a pregnancy. Also, most of the patients, you need to review your medications, whether they are safe in pregnancy. A lot of times we have patients who have hypertension who present to us and who are planning a pregnancy. Quite often they would be on some antihypertensives like ACE inhibitors, that is, for example, your telmisartan. These medicines, if used in pregnancy, are associated with certain kidney defects in the baby and are strongly contraindicated in pregnancy. So, if you are hypertensive, it is important that you meet a doctor, tell them of your intention of getting pregnant, so that they can put you on some other tablets which are safer in pregnancy, and see whether what dose would be right for you to continue. So, hypertensives again need to meet their doctors. If you have any sort of thyroid disorder, it's very important that it is corrected in pregnancy. And you measure your thyroid levels regularly in pregnancy, because the thyroid levels tend to fluctuate a lot in pregnancy. And it's essential that we maintain them in a certain range, because again, the thyroid hormone is very important for the proper development of the baby's central nervous system. The other thing is also about if you're someone who has epilepsy. Epilepsy is something which can worsen in your pregnancy, and a lot of the anti-epileptics which are given are not at all safe in pregnancy. They are associated with a lot of abnormalities in the baby. So it's important that you are switched on to some other anti-epileptics which are safe in pregnancy, and your doctor has enough time before your pregnancy to try and gauge what dose of these newer medications is good enough to try and control your seizures. So this is in brief about some of the common disorders and how important it is for you to plan your pregnancy if you are suffering from them. So again, this I've covered about what is the importance of reviewing your current medications. In this, I would like to highlight that in case, because of any particular reason, you are on some medicines which are known to be teratogenic, which means that they are harmful to the baby in pregnancy. They are known to be harmful in pregnancy. In that case, please be smart enough and use some sort of contraception while you're on these medicines. As long as you are on any medicines which are known to be teratogenic, use a safe contraception. And once you're done with the medicines, then you can plan that pregnancy. Vice versa, when you're planning a pregnancy, consult your doctor to see that whatever medicines you're on are safe in pregnancy. For males, it's important that if you're planning a pregnancy, and if you feel that you are having difficulty in conceiving or your semen counts are plummeting, in that case, just kind of review your medicines to see if for any reason you've been put on any androgens or any testosterone supplements, because surprise, surprise, they are associated with fall in the semen counts. So that is one thing which we need to review a male patient for. Also, when you go to a doctor to review your current medications, it's very important that you also mention whatever herbal and nutritional supplements you are on. A lot of time patients feel that, okay, herbal nutrition supplements, these are just like, there's no harm from them, they're all safe. But that's not true. Most of these are not regulated and they have high levels of heavy metals in them. So please discuss with your doctor whatever even nutritional supplements and herbal medications you are on before you're planning a pregnancy, so that you make a safer choice for you and your baby. Uh, One of the other things that we look at when we are doing a preconception counseling for a patient is review their family and genetic history. This is especially important for those patients where they have a family history of significance. If you have a family history of having some genetic disorder, like if you have some thalassemia, sickle cell disease, or cystic fibrosis, or if you have a family history of some cancer, like a breast cancer, ovarian cancer, you have children who are born with a certain syndrome, or you have a personal history where you have had a previous child with some sort of genetic disorder or with Down syndrome, or you are a patient where you've had previous multiple recurrent miscarriages, or you are a known carrier of some disease. All these patients have, it's important that their family and genetic history is thoroughly evaluated and screened. The importance of this being that it helps you understand what is the risk of you passing on or transmitting the same disease to your offspring. It helps in understanding what is the risk of that particular disease to your offspring and what are the options available in order to reduce the risk of transmission. Like for some diseases, if you have spontaneously conceived and if you're a known carrier of something lethal, then in that case, what can be done is that you can undergo some antenatal screening tests, which can range for some ultrasound scans to even an amniocentesis to try and understand whether the baby that you're carrying is suffering from that particular genetic condition. If you are needing an IVF, or if you're a carrier of some lethal condition, you can actually undergo an IVF to enable something called as a PGTA, which is your preconceptional genetic testing. So that basically helps in testing the embryos for any genetic problem before they are transferred, so that only the healthy embryos are transferred to you and your baby which is born in turn is healthy and disease free. So this is what we mean in reviewing your family and genetic history, and it's extremely important for those patients where they have history of consanguinity, where you have married in the family, you have a family history of some medical condition, or if you yourself have history of recurrent miscarriages or previously having a baby with some genetic disorder. Immunization is another important topic which would be covered in a preconceptional counseling and is a positive step towards having a healthy pregnancy. Now, what does immunization? Immunization means vaccination. As we all know, vaccination is basically an injection which is taken in order to protect you from a particular disease. Now, out of the various vaccinations which are available, there are some which are safe in pregnancy and some which are not. The common vaccinations which are advised for people who are planning a pregnancy are for rubella and chickenpox. In India, mainly we go for a rubella vaccination. Now, this is a live vaccine, so it's advised that if you are planning a pregnancy, you first get a rubella test done for you to see whether you have antibodies against rubella. Now, suppose if your rubella antibody test comes negative, that means you have never been exposed to this infection. You don't have adequate immunity against it. So it is advisable that you take the vaccine. Because it is a live vaccine, when you take the vaccine, you should exercise contraception for a whole period of 28 days, and then you can start planning a pregnancy. Why is it important to get uh, vaccinated against rubella? Because rubella infection, if you get it when you're not pregnant, it's fairly benign. It just leads to a mild innocuous rash. But if you get it in pregnancy, it can be really harmful to the baby, where it can cause blindness in the baby, it can cause deafness, and it can even cause heart disease based on what stage of pregnancy you contract the infection. So that's rubella. You can even take a chickenpox vaccine in case if you have not had chickenpox before. And again, there again, you would need to exercise contraception for 28 days after you have taken the vaccine. You can also consider taking a Tdap vaccine, and even if you've not taken it before planning a pregnancy, it would anyways be given to you again in pregnancy between 27 to 36 weeks. Tdap vaccine would mean your tetanus, diphtheria, and pertussis vaccine. Now, for patients who have a history of having multiple sexual partners, or who are having recurrent any history, any high risk group, it is important that you undergo an STI screening while you're still planning a pregnancy, so that in case if you have any of the infections like gonorrhea, chlamydia, syphilis, or HIV, you can be adequately treated for it before you plan a pregnancy in order to reduce the risk of your child contracting these infections in turn. So that's another thing which your doctor will be screening you for during a session of pre-pregnancy preconception counseling. Another thing which is very important and which is screened for and advised against during a preconception counseling is substance use assessment. So during this whole counseling session, what we do is we re-emphasize the importance of abstaining from smoking and alcohol consumption during pregnancy. The reason being, let's talk about smoking first. Smoking is extremely harmful. It reduces your ovarian reserve. It pushes you towards menopause. It stops the ciliary function of your tubes, making you more prone for having a pregnancy in the tubes rather than the normal location of the uterus. So it makes you more prone for something called as ectopic pregnancy. If you're smoking during pregnancy, it increases your risk of having a small first gestation pregnancy, intrauterine growth restriction of the baby. The baby will be small. The baby's growth will be restricted. It increases your risk of having a placenta, which is low-lying, of having bleeding in pregnancy, of having a preterm labor, pre-labor rupture of membranes. Why would you want to do all this to your baby? So that is the reason that it's best that you stop smoking at the earliest. Now, also, the other thing being about alcohol. Alcohol is more harmful in females than in males. The fetal alcohol spectrum disorders are most severe, and they are the result of severe, and quite a few of them are associated with prenatal drinking. So if you are planning a pregnancy, please stop your alcohol consumption altogether. Otherwise, it will lead to central nervous system abnormalities, growth defects, and facial abnormalities in your baby. And even once your baby grows up, a lot of these kids where the mothers indulged in alcohol consumption during pregnancy, it was seen to harm their cognitive development and their behavioral development as the kids were growing. Now, another important thing which is assessed during the preconception counseling is the teratogens and what kind of environmental occupational exposures are you being subjected to. So it is important. A lot of times in some industries like your agriculture, where where people are being exposed to pesticides, or where you are dealing with heavy metals or organic solvents, or some dry cleaning industry, and even where you are exposed to some sort of radiation, though it's pretty much regulated nowadays. But still, these are the industries where ladies as well as men might be exposed to some radiations and chemicals which are harmful to their gametes and which can in turn impair their pregnancy. So it's important that if you're planning a pregnancy, you discuss with your doctor or with the occupational health expert about the kind of environment that you're working in to assess whether it's a safe environment for you to plan a pregnancy. So these are the topics, these are the things which are covered during preconception counseling, which you need to be aware of, So just to summarize, the important things are you need to start a folic acid supplement if you're planning a pregnancy, and it needs to be taken daily, starting from 3 months before your pregnancy to 3 months, first 3 months of your pregnancy. The second important thing is that you try and achieve a body mass index which falls in the normal range. So that would be somewhere in a BMI of about range of about 18.5 to about 22.9 kilogram per meter square. The other important thing is indulge in some sort of exercise, be physically active to maximize your chance of conception and to be physically fit for a pregnancy and continue your physical activity into pregnancy. Just be mindful of being hydrated, well hydrated, and discuss the exercises which you're doing with your health practitioner before you start them. The other important thing is do discuss with your doctor whatever pre-existing medical conditions you have, and also discuss the safety of the medicines that you are on for your baby. Understand how your disease process would behave in your pregnancy, whether it would be better in your pregnancy or whether it would worsen, so that you can be mentally prepared and discuss with your doctor about how it would be managed accordingly. Review all the medicines which you're taking, the safety in pregnancy. If you're a diabetic, see that your sugars are well under, HbA1c is well under 6.5 before you plan a pregnancy. And even discuss with your doctor whatever nutritional supplements you are on, because some of them might be harmful to your baby. See that you are not smoking or consuming alcohol. If you're planning a pregnancy, strictly abstain from both of them. And the last thing is your vaccinations. If you are planning a pregnancy, it would be advisable that you consider rubella vaccine if you are non-immune to rubella, and have a month's contraception with it before starting your pregnancy journey. And if you're working, get your environment assessed. If you're working in some industry where you're handling chemicals or radiation or some organic solvents, speak to an occupational expert specialist regarding the safety of the environment for a pregnancy. Well, that's all you need to know about preconception counseling, and that is definitely the first step towards a healthy pregnancy. So if you have any questions, you can put it in the chat box for us and I'll be happy to answer them. If not, please leave them in the chat box and we will get back to you with the answers. Thank you, Dhanlakshmi. That's really sweet of you. Well, I think you all can get back to us and I'll answer all your questions in the chat box. Well, that's all from me for today. Thank you very much.